Hello, everyone. This project talks about health disparities in rural and urban communities. This project was created by Andrew Anand, Nilo Chowdhury, Hussein Mohammed, and Mauricio Rocha. First, we're going to discuss the problem. So, the problem faced in urban, I'm going to talk about right now the problem faced in urban and rural communities. So, when we started this project, our group wanted to explore health disparities that affect people in very different ways depending on where they live. That's why we decided to look at both rural and urban communities. These two settings might look opposite, but what really stood out to us is how each faces its own unique set of challenges and how both reflect deeper issues of equity in healthcare. In rural areas, some of the most pressing problems are tied to access. Many rural communities are food deserts with limited places to buy fresh and healthy food. Healthcare is harder to reach. Hospitals can be far, specialists often don't practice nearby, and emergency services may take longer to arrive. On top of that, environmental exposures like pesticides, contamination in water, and poor air quality from agricultural activity create additional health risks. For Native American reservations, which are often rural, these problems are even more severe due to a history of systemic neglect. In urban communities, the picture looks different but still highlights inequity. Access to health care can be better, especially in wealthier neighborhoods, but affordability becomes the barrier. High costs of living, housing, and insurance make healthcare less accessible for lower income families. Urban areas also face poor air quality, but instead of agriculture, the cause is heavy traffic and industrial activity. Neighborhood safety and stress also play a role, with higher income areas enjoying better quality of life and lower risks of conditions like hypertension, while disadvantaged neighborhoods often carry a heavier burden of disease. We chose to study both settings because together they show that health disparities are not one-dimensional. They don't look the same everywhere. In rural areas, geography and infrastructure are the main barriers. In urban areas, the barriers are often financial, environmental, and social. By comparing the two, we wanted to highlight that health equity requires solutions that are flexible and tailored to different contexts. As future health professionals, this matters to us because whether we work in a rural clinic or an urban hospital, we need to understand how environment, access, and social conditions shape people's health. Our project is about making sure no community is overlooked in the pursuit of equity.
So I believe that some of the very attainable solutions for these disparities is first and foremost education. I think things like health literacy is a very important tool for the community so they can have a better quality of life. I think community leaders and healthcare workers should help their members understand the terms like food deserts and what they could do to help combat those issues. Providing them with information such as where the closest grocery store is or farmers market, as well as affordable gyms or safe parks are located, can really contribute. So, by being educated about these areas, you can better understand ways to improve your lifestyle. I also believe that local government should actively invest in their own communities with projects such as recreation centers. These are places where classes can be taught, as well as safe place where children and adults can convene, exercise, and just have fun. So issues such as the that plague some of the rural communities, but also affect urban ones, are both some of these educational problems. But for rural communities, like Mauricio said earlier, some of the statistics even show that emergency services have a longer time on average to reach those places just because they're stationed so far out and just have less hospitals near those. So more health complications can happen to those individuals. So by doing things like teaching some basic life support skills and CPR in some of these rec classes, you're going to give your community more tools to help ensure their own health. Like I said, this is a issue in more rural communities, but there's some problems that are also present in urban ones. I think the most obvious but expensive solution would just be investing more into infrastructure in these locations. Even lots of urban communities lack some proper hospital facilities based on where they are. Some places like Los Angeles or Sacramento, some areas don't even have high amount of trauma centers, or they're just overstaffed in general. Some other solutions can be businesses that help provide financial services to some low income communities. So, by having these services, they could become more financially secure, which directly would correlate with a stability in their lifestyle, which would help their overall health. But even with these proposed solutions, there's always some issues when it comes to introducing infrastructure that comes with gentrification and pricing out the original members of that community. There needs to be some effort put in the place that allows these necessities, such as grocery stores and clinics, to be established in those communities, while also letting the people that live in those neighborhoods still live happy and healthy lives.
Access to healthcare should be equal for all without discrimination against income, race, or where one lives. Here, four different careers are shown with their respective career fields: a mechanic, doctor, teacher and coach, and a construction worker, displaying their career in front of the man who seeks to keep quality healthcare only for profit. Image 2 displays careers taking a stand against oppression, unification of the foundational careers that are seen in every environment, both rural and urban. Image 3 we have shows the foundational career roles looking down on those who deem unequal healthcare and unequal access to healthcare as something that can be normalized and should be normalized. Image 4 shows the careers being able to work together and learn from each other on how to achieve quality healthcare equity for all, no matter race, social status, or environment that they are in.
As a future doctor myself, education and health literacy is very important for people in rural communities and from lower socioeconomic background. And as part of my oath, I should have no reason to reject any patient, no matter what their background was, whether it's their financial status, sex, race, or sexual orientation. I will I will also persuade my fellow other colleagues, other EMTs and firefighters, to also let's try to, as soon as I get more experience in my job, I would say let's try to bring all the self-services and maybe start new hospitals in these rural communities that need our help and increase awareness. Or maybe if they cannot afford all the healthcare, we have the knowledge, we can provide them the education, as Hussein said, to teach them basic life-saving skills like CPR and AED usage. Even teaching a little more advanced tricks is very useful. And even despite the fact it'll take a long time for EMS services to get to these locations, as Mauricio said, why not provide them the same skills as EMS services have? And this will be a greatest asset for any community. Thank you very much. And let's go out there and make a difference.